Alright, so in this video, we're going to show you how to grade / quantify pulse, reflexes, as well as muscle strength clinically. So the reason we want to quantify it is to make it nice, short, and simple, right? Because the quality of a pulse, quality of a reflex, as well as muscle strength is just that. It's qualitative data, right? So we're trying to quantify it in order to make it easy, quick, fast for other physicians to look at and be like, okay, that's what's going on. So first, we're going to start off with pulse. Pulse is graded from a 0 to 4. As you can see, 5 is not applicable, right? Pulse grade of 0 is an absent pulse, right? Now, there are a few pathologies that can lead to absent pulse or cause an absent pulse, one of which is VFib, ventricular fibrillation, and claudication. A grade of 1 pulse would be diminished. Now, some pathologies related to a diminished pulse would be like hypothyroidism, since thyroid hormone leads to an increased metabolic rate, and an increased metabolic rate would lead to an increased myocardial contractility as well as heart rate. A low amount of thyroid hormone would cause a diminished pulse. And along with hypothyroidism, peripheral artery disease. PAD is usually concurrent with diabetes mellitus. 2 is normal. As such, there won't be any pathologies associated with that. 3 would be brisk or more than normal. This isn't necessarily a pathology, but exercise as well as caffeine intake can lead to a pulse grade of 3 or a brisk pulse, as well as fever. Fever is a product of inflammation, but also another product of inflammation is hyperemia, increased blood flow to a specific side of the body. When you have fever and or inflammation, that's what's going to cause the brisk heart rate or a grade of 3, because the hyperemia is due to increased contractility of the heart. For grade number 4, pulse, it's going to be bounding. Now, a bounding pulse can be due to a few things, namely hyperthyroidism, and long-term chronic kidney disease. The reason long-term chronic kidney disease will lead to a bounding heart rate is because of the anemia it produces. Chronic kidney disease produces anemia because you can't produce erythropoietin, which leads to the synthesis and maturation of red blood cells. So if you can't produce erythropoietin, which means you have less red blood cells circulating, which means you have a decreased oxygen carrying capacity, and therefore your heart's going to be pumping harder and faster in order to circulate the oxygen efficiently. Time to move on to reflexes. So reflexes, grades 0 through 3, are going to be the same as pulse, and 4 is going to be a little bit different. So grade of 0 would be absent, grade of 1 would be diminished, grade of 2 would be normal, grade 3 would be over normal or more than normal, and 4, which is where they differ, it's going to be hyperactive / clonus. Now, absent reflexes will be due to lower motor neuron lesions and Guillain-Barré syndrome, which essentially are very similar in effect of the body. Diminished reflexes, just like pulse, can be due to hypothyroidism. Again, a lower metabolic rate would lead to decreased contractility. Along with hypothyroidism, a diminished reflex would be caused by muscular dystrophy or Duchenne muscular dystrophy. DMD, Duchenne muscular dystrophy. And this essentially is, if you have less muscle there, it's going to be less of a reflex when you hit it with the reflex hammer. That's essentially all. 2, normal, so there won't be any pathologies associated with a grade. Now, over normal or more than normal for reflexes is going to be hyperthyroidism, right? Increased metabolic activity, increased muscle contraction, higher grade reflex. Now, for hyperactivity or clonus, right? One thing that can cause hyperactivity, continuous muscle contractions, and or spastic movements of the muscles is hypocalcemia. Hypocalcemia can also lead to like seizures and tetany and, like I said, spastic muscle contractions, but we'll get into that in another video. Right? Along with hypocalcemia, you have an upper motor neuron lesion. And the upper motor neuron lesion essentially leads to clonus. Clonus is tested for most often in a clinical setting by dorsiflexing the foot or lifting your foot up off of the gas pedal, which would cause the Achilles heel or the calf to continuously contract, make rhythmic contractions by themselves as you're placing pressure, stretching that muscle. Okay, and muscle strength is going to be a little bit different. It's going to be graded from 0 to 5. And unlike pulse and reflexes, 2 is not going to be normal. 5 is actually going to be normal. Right? So, 0. Right. So, we know that 5 is normal, but let's go through all the numbers so that we can correctly explain it and that you guys understand what it takes to be grade 0 versus grade 1 versus 2, 4 versus 5. So, grade 0, no movement and no contraction. Grade 1 is going to be a twitching or a flinching of the muscle. Grade 2 is going to be a full range of motion with that muscle without doing it against gravity. And I'm going to show you guys later exactly what all this stands for. 2, full range of motion without gravity. 3 is going to be a full range of motion against gravity. Okay. 4 is going to be a full range of motion against gravity. Against gravity. But also against transient resistance. And number 5, like I said, is normal, which is full range of motion against gravity and against resistance. Okay, so to grade muscle strength, I'm going to show you using my forearm. We're going to be using the biceps muscle. That's what raises the hand up towards the shoulder and towards the body. My right arm is a patient arm. My left arm will be a physician arm. So patient arm is going to be flat on the table, right, from hand to elbow. You ask the patient to move it off the table. A grade 0 would be no movement at all. So if you say, pick your hand up to your shoulder, pull your hand towards you, and it doesn't move at all, not even a twitch, that's going to be grade 0 right here, no movement. Now, if you say, pick up your hand, pick up your arm, and it's like twitching, I don't know if you ever see that, but there's twitching in the bicep, okay? It's going to be grade 1. Grade 2. Grade 2 is going to look a lot like grade 1, right? Against gravity, on hand flat on the table, it's going to look like twitching, flinching of the muscle. But if you pick the arm up sideways and support their arm, they can actually move through the full range of motions, just not against gravity. So if they're twitching down here, but they can move full range of motion, that muscle strength is a grade 2. A grade 3 would be a full range of motion against gravity, right? So if your arm is flat on the table and you ask the patient to pick their arm up to their shoulder, they can do that through the full range of motion against gravity. But once you start applying some resistance, they can't do it anymore. They can't pick it up even a little bit. A number 4, have your hand flat on the table. They can pick it up full range of motion against gravity and some slight resistance. But like I said, here is transient resistance, which means short-term resistance. So if you ask them to pull their hand and resist against you, they can do it for a short period of time, but then at some point they can't sustain those muscular contractions anymore and their hand will fall back to the table, right? That'll be a grade 4. You can go against some resistance, but you can't sustain the position for long enough. Grade 5, normal, like I said, it's going to be a full range of motion against gravity, as well as against resistance, and being able to sustain the position that you're in. So it can be full resistance, it can be partial resistance, it can be moderate, light, and resistance and muscle strength when you're testing from grades 3 to 5, it's going to be different for your patients depending on age, gender, and other factors such as their diseases, their underlying conditions. So please, if it's an 80-year-old woman, don't say she's a level 4 or a level 3 because you're pushing down as hard as you can and she's not moving her arm at all, right? So, and if it's an 18-year-old young man or young woman who goes to the gym regularly, don't just apply moderate resistance and then be like, oh, they're great, because it may as well be a 4, but you're not applying enough resistance to them. So anyway, hope that helped y'all. Again, here's the table. This is how to grade / quantify qualitative data such as pulse, reflexes, and muscle strength. Hope this is helpful. Y'all have a great day. Peace.